What do my liver test numbers mean? Imagine your liver as a busy factory, constantly working to process nutrients, produce proteins, and filter out toxins. When you get liver test results, it's like getting a report card on how well that factory is functioning. These numbers are measurements of specific enzymes, proteins, and substances in your blood that tell us about your liver's health. Understanding what these numbers mean can help you and your healthcare provider catch issues early, including the risk of liver cancer. Let's start with the enzymes called alanine transaminase and aspartate transaminase. Alanine transaminase is mostly found inside liver cells. When liver cells are injured or inflamed, this enzyme leaks into the blood, raising its levels. Normal levels are usually between 7 and 55 units per liter, but this can vary slightly depending on the lab. Mild increases might happen with fatty liver or viral hepatitis, while very high levels could point to more serious liver damage. Aspartate transaminase is found in the liver but also in other tissues like the heart and muscles. Its normal range is about 8 to 48 units per liter. Elevated AST can indicate liver injury but isn't specific to the liver alone. If AST is about twice as high as ALT, it might suggest alcohol-related liver injury. Next, we have alkaline phosphatase. This enzyme is present in the liver, bile ducts, bones, and other tissues. Normal levels are roughly 40 to 129 units per liter. When ALP levels are high, especially if gamma-glutamyl transferase is also elevated, it can suggest bile duct blockage or cholestasis. But if ALP is high and GGT is normal, the cause might be related to bones rather than the liver. Gamma-glutamyl transferase is mainly in the liver and bile ducts. Normal levels are about 8 to 60 units per liter. Elevated GGT often goes hand in hand with ALP increases and can be raised by alcohol use or liver disease. It helps doctors determine if liver or bile duct issues are involved. Bilirubin is a yellow pigment produced when red blood cells break down. Normal total bilirubin is about 0.1 to 1.2 milligrams per deciliter. When bilirubin levels are high, it can cause jaundice, which is yellowing of the skin and eyes. Elevated bilirubin might mean your liver isn't processing waste properly, or there could be a blockage in the bile ducts. Albumin is a protein made by the liver that helps keep fluid in your blood vessels. Normal levels are about 3.5 to 5 grams per deciliter. Low albumin can suggest chronic liver disease or that your liver isn't making enough proteins. Prothrombin time measures how long it takes your blood to clot. Normal is roughly 9.4 to 12.5 seconds. If this is prolonged, it can mean your liver isn't producing enough clotting factors, which might happen in advanced liver disease. Now, how do these numbers come together? If your tests show high ALT, especially if it's more than 10 times the upper limit, it suggests liver cell injury. This pattern is common in viral hepatitis, drug effects, or sometimes liver cancer. If ALP and GGT are high but ALT is normal or only mildly elevated, it might point to bile duct problems. When both ALT and ALP are high, it could be a mix of liver cell injury and bile duct issues. To help classify these patterns, doctors often use something called the R ratio. If the ratio is above 5, it indicates a hepatocellular pattern, meaning liver cells are damaged. If it's below 2, it suggests cholestasis or bile flow problems. Between 2 and 5, it's a mixed pattern. It's important to remember that normal liver tests do not always mean your liver is perfectly healthy. Some chronic conditions like cirrhosis can have normal enzyme levels. Mild elevations can sometimes be caused by factors outside the liver, such as muscle injury or age-related changes. Also, abnormal results should always be interpreted in the context of your symptoms, medical history, and possibly imaging or biopsy. In the context of liver health and liver cancer, these test numbers are useful clues but are not definitive on their own. Elevated enzymes can signal liver injury or bile duct issues, which may be related to underlying conditions like hepatitis or cirrhosis that increase liver cancer risk. However, diagnosing liver cancer requires imaging tests and sometimes a biopsy. Always discuss your results with a healthcare professional who can interpret them in your overall health picture and guide you on next steps. Remember, understanding your liver health is a vital part of maintaining overall wellness, and early detection can make a big difference.